Have you ever felt like your mind just won't stop racing? Like you're always expecting something to go wrong, even when things seem fine? That could be more than just everyday stress. It might be generalized anxiety disorder, or GAD. So, let's take a closer look at what generalized anxiety disorder, or GAD, actually is. Generalized anxiety disorder is more than just occasional worrying. It's a long-term condition that causes people to feel anxious most days, often without a clear reason. GAD affects about 3 to 6% of people worldwide. That's millions of individuals dealing with daily, persistent anxiety. It's more common in women than men, and often begins in early adulthood, though it can develop at any age. So, the exact cause of generalized anxiety disorder isn't fully understood, but honestly, it's probably a mix of different factors. Genetics play a role. It can actually run in families. Then there's brain chemistry, especially in areas that control our emotions. Personality matters too, particularly for folks who are naturally more cautious or sensitive. And of course, life experiences like trauma, chronic stress, or childhood abuse can be major contributors. The main symptom is, well, excessive worry. Worrying about work, health, finances, family, and even really minor matters. Other signs include restlessness or just feeling on edge, fatigue, having a hard time concentrating, muscle tension, sleep disturbances, and, irritability. And these symptoms persist for 6 months or more and interfere with daily life. Generalized anxiety disorder is diagnosed through a combination of clinical interviews, questionnaires, and by ruling out other possible conditions. Your doctor may also check for physical issues, like thyroid problems, that can actually mimic anxiety. So the good news, generalized anxiety disorder, or GAD, is treatable. Common options include cognitive behavioral therapy, often referred to as CBT, which helps change thought patterns. Then there are medications like SSRIs and SNRIs, which are used for long-term control. And don't forget about lifestyle changes, such as incorporating exercise, mindfulness, and stress management into your daily routine. For many people, a combination of therapy and medication works best. While you can't always prevent generalized anxiety disorder, you can certainly reduce your risk. Start by learning to recognize the early signs of anxiety. Practice relaxation techniques regularly. Stay physically active and make sure to build a support system around you. Also, try to limit your intake of caffeine and alcohol. If you or someone you know is struggling with persistent worry, don't ignore it. Help is available, and you don't have to live under the weight of anxiety every day. Remember, you are not alone. Reach out. Thanks for watching. If you found this helpful, please like, share, and subscribe for more mental health videos.